All right, Veruca. So I understand you have a wart under here, and I'm going to go ahead and get that frozen for you today. We'll get that treated. Oh! What the health?
Well, my frog has a wart too.
Veruca, I already said we don't get warts from frogs or toads.
Oh.
Hello, and welcome to another episode of What the Health. Today we're going to talk about a common problem, warts. Warts are very common. They're common in the age group of children, teenagers, and young adults. And the human papillomavirus is actually the cause. Warts can be located anywhere on the body, but most commonly you'll see warts that are on the hands, on the feet, on forearms, but they can be anywhere. Warts oftentimes present as being like a heavy callus, a mound, just an eruption on the skin. Those warts that are on the feet oftentimes are flatter, and because of the weight of our body pressing on the wart, they actually grow up into our tissues rather than elevating on the tissues. Because warts are a virus, they are highly contagious. They enter our skin as the virus sheds and comes in through small breaks in the skin integrity. So people who have warts may find that they spread on themselves because they might pick at them. More common in people who have dry, flaky skin, people with eczema, psoriasis. When we find it on the feet, there might also be an issue with athlete's foot, something we've talked about in the past. There are a number of ways that you really can treat a wart. Do they have to be treated? Not necessarily. The human papillomavirus, when it comes to warts, the type of virus strain that causes that, really the wart would go away after a couple of years, usually less than 2 years actually, if it was left alone, because our immune system starts to recognize it. Why then do people have their warts removed? Because they are so highly contagious that they can spread to other people. They can be unsightly, but also they're commonly located in areas that we use and that we can feel, and so they can be quite bothersome as well. Treatments of that, you could go to the drugstore and you can pick up some over-the-counter treatments like Compound W. Some of the treatments that are available over the counter are types that actually just peel away the wart. There are some systems that try to freeze the wart and give it frostbite. There are some homeopathic or wives' tale type treatments that actually can be quite successful. One of those is duct tape. Take the wart, try to get the thickened tissue down first, maybe using a fingernail file or an emery board, and then applying a piece of duct tape over top of the area of the wart, and then leaving the duct tape in place for 5 to 6 days and peeling it off. By putting it over the area of the wart, it draws attention of the body's immune system to that virus in that area and upregulates the immune response and tries to fight that virus. Also, when you peel it away, it's removing or debriding the dead tissue, and if the wart is still present, you could put another piece of duct tape back on. And I have known people who have used that and have had results with it. In the clinic setting, there are a number of different things that can be done. There is cautery, where the wart can be burned. There's liquid nitrogen. There are injections where different types of bacteria or fungus can be put into the wart to also try to attack that human papillomavirus. And sometimes it's just cut away completely. Okay, Veruca. So now that I've cleaned that off, I've placed this cone over the area where your wart is, and I'm going to put some freezing spray in there to fill it and administer the treatment. Okay. And that bubbling is normal. We wait for that to evaporate. And what this will do is it will form a bit of an ice ball over that area, and we're literally giving the wart frostbite right now, which will kill that virus that's causing the wart. Are you doing okay?
I'm doing fine. I'm surprised it doesn't hurt.
Oh, very good. And you'll see now when I pull this away, the frost ice ball, and that shows effective treatment. And then in a few moments that will thaw out and it will look like the wart did just previous to doing the treatment. Sometimes with a large wart we have to do this more than one time in a row. And once again, you can't get warts from a frog or a toad. Thank you for tuning in to another episode of What the Health.